module covers risk factors, physical activity, and brain function. It also contains a section on cognitive function. In terms of effects of acute exercise on anxiety, acute exercise is usually referred to moderate to high intensities greater than 60% VO2 max, and it is related to state anxiety reduction. In fact, the anxiolytic effect is independent of the type of exercise and time of day. Additionally, exercise with very high intensities may lead to anxiogenic effect. Regularly participation in physical exercise programs can also reduce trait anxiety. The chronic exercise can present clear risk benefits for anxious people, and the effect is greater than placebo and independent from previous expectations. Common mental health disorders. We may also cover psychological distress. What is psychological distress? Psychological distress refers to mental stressors that are not congruous with good health. Feelings you may have when you are sick or facing medical conditions such as surgery are examples of distress. Psychological distress is often measured as subjective feelings of a lack of well-being in subjects in exercise studies. Higher reported levels of well-being are usually associated with a higher quality of life. Common risk factors for mental disorders include physical inactivity, poor self-esteem, distress, drug abuse, alcohol abuse, negative lifestyle behaviors, age, sex, suicidal thoughts, and medical treatments. What are 4 common risk factors for mental or sleep disorders? Answers may vary but include the following: physical inactivity, substance abuse including alcohol, low self-esteem, distress, negative lifestyle behaviors, age, sex, heredity genetics, suicidal thoughts, and medical treatments, illness, surgery, disability. What strategies are useful for testing for mental disorders? Tests to evaluate, diagnose, and treat mental health disorders are typically conducted by physicians or researchers with expertise in the area. Screening tests to identify cases to refer for more extensive diagnostic workups are often used as the first step in evaluating mental health disorders. These tests range from self-administered questionnaires to in-person evaluations and observational studies. Exercise and physical activity may also affect brain function in people without mental health disorders. Many have wondered, can physical activity make us smarter or help us remember more things for longer? Do people who are more physically active have better cognitive function than similar, but inactive people? Do physically active children do better in school than inactive children? Clearly, these questions can be related to mental health, and that compromised brain function may be a subclinical precursor to more serious mental disorders. Cognitive function declines accelerate rapidly in older adults. With populations in developed countries aging rapidly, questions of how physical activity and exercise affect brain function become most important as we seek to keep our parents and grandparents functionally independent for as long as possible. Brain function outcomes that researchers have investigated for an association with physical activity and exercise are shown in the figure. This is not an exhaustive list, and studies have varied from single-bout exercise studies to short-term training studies. Although definitive conclusions regarding the role physical activity plays in brain function remain to be put forward, the topics highlighted in this figure are some of the most promising areas for future work. Mental health benefits have been found in people who do aerobic or a combination of aerobic and muscle strengthening activities 3 to 5 days a week for 30 to 60 minutes at a time. The figure on the right is a summary of recent research on dose-response relationship between physical activity and exercise and feelings of distress. As shown, modest levels of physical activity are associated with significantly lower odds of distress, or higher odds of well-being, than low levels of physical activity are. Further, it appears that higher doses and intensities of physical activity do not confer additional benefits. The data in the figure provide more evidence of the health benefits of physical activity. The mental health benefits are not limited only to athletes and people who exercise at the highest levels. How much physical activity or exercise is necessary to reduce the risk of mental disorders and improve sleep? Dose of physical activity or exercise needed to ameliorate mental health disorders, for example, depression and distress, is 3 to 5 days per week of 30 to 60-minute sessions of moderate to vigorous activities. Moderate evidence. Aerobic or muscle strengthening activities, or both, appear to have similar effects, although the minimal or optimal type or amount of physical activity or exercise for mental health benefits is not yet known.